A recent study shows omega-3 fatty acids and vitamin D may not be as effective as hoped. Dr. Greg Silverman is joining us right now with what the study means.
All right, the VITAL study, which was published in the New England Journal last month, followed about 25,000 people, and they either gave them vitamin D3, 2,000 international units, or a gram of omega-3 fatty acids. And they watched for several things. Vitamin D was supposed to lower the risk of cancers, and the omega-3s are supposed to reduce the risk of heart attacks and strokes. And what it found was there is a trend toward that, but no sensitivity, no specificity that says, yeah, take it, you're going to reduce your risk of heart attacks and strokes. There are, however, a subgroup of people in those, that is African Americans, that may have a trend toward decreasing their risk of heart attacks. But overall, really not much new news here.
Isn't there sometimes a daily recommended dose, or like you see the commercials
Correct.
touting that? Is that true?
No. I mean, according to these studies, the answer is no. I mean, we keep doing these studies again and again. There's been other studies. The British have done studies on omega-3s, and nothing really trends out toward that. What it really does trend out toward is saying, look, if you eat fish, at least 1.5 servings a week, which is about 3 ounces a week, or 4 ounces a week, you don't really need any additional supplementation. And then the question of vitamin D as a form of lowering cancers really doesn't trend out toward that. It doesn't trend out toward anything.
And it's not going to do any harm if you take it on top of that.
Except to your pocketbook, which is you're wasting your money, basically. There's really no trends toward it. Again, realize healthy lifestyles, which is what we've been talking about, which is watching your weight, watching your sugars, watching your blood pressures. Those get you those small amounts really get you the farthest out there. That is, watching your blood pressure really decreases your risk of strokes. Watching your diabetes, if you have diabetes, really decreases your risk of peripheral vascular disease and heart attacks. And taking certain medicines. We've gone over these. We've gone over these studies about whether or not aspirin helps. The answer is not really. And now we've got a study that suggests whether or not vitamin D3 and whether or not omega-3s really decrease the risk. The answer is not really if you're an otherwise healthy person.
There will be people that stick to this, and then there'll be people looking for the next thing.
How many times do you need to do this? And, you know, we've done this again and again. There are several other studies out there. And we've done it again and again, and the answer is, sorry, not big enough to warrant saying, yeah, you're not going to do this. Of note, in the vitamin D, there was a trend toward decreasing overall cancer mortality, which I didn't understand. That is cancer deaths, but didn't reduce the risk of cancers.
Feels like it's almost a placebo effect, if you will.
There are a lot of that. There's a lot of those in medicine, and there's a lot of people buying a lot of stuff out there, and there's a lot of people selling a lot of stuff out there that say, yeah, we're going to reduce this and this and this. And the answer is, oh, sorry.
Dr. Silverman, always a pleasure, sir. Thank you. Happy Thanksgiving to you.
Same to you.
Okay.